Welcome to Geo IT Solution, Excellence in Medical Billing. Pain Management Billing Services Key Challenges Facing in 2026. Here's a comprehensive, up-to-date overview of the key challenges facing pain management billing services in 2026, based on current industry trends, payer behavior, regulatory changes, and revenue cycle insights.
1. Increasing claim denials and complex payer rules. Higher denial rates remain a top challenge as payers tighten scrutiny and enforce stricter documentation, medical necessity, and coding requirements. Even tiny errors, e.g. wrong modifiers or outdated CPT codes, can lead to rejections or underpayments. Payers are applying more prepayment and post-payment reviews, slowing down reimbursements and increasing administrative workload. Why this matters in 2026. Denials disrupt cash flow and require significant staff time to appeal, reducing operational efficiency.
2. Evolving coding, documentation, and compliance pressures. Pain management involves complex procedures and a high volume of unique CPT-ICD-10 codes that change yearly, making ongoing training and updates essential. Compliance requirements, e.g. USP, CMS, HIPAA, payer-specific rules, are expanding, and documentation must justify medical necessity, especially for interventional procedures and controlled substances. Practices face heightened audit activity and regulatory compliance risk tied to documentation and coding quality. Impact. Billing teams must balance accuracy with speed while preventing compliance violations and costly penalties.
3. Intensive prior authorization workloads. Prior authorizations are increasingly required for many pain management procedures, medications, or injections, often with stringent criteria and documentation requirements. Delays or omissions in authorization lead directly to denials or payment holds, increasing administrative burden and revenue cycle delays. In 2026, authorization processes have become more complex, particularly as payers integrate automated reviews and fresh approval protocols.
4. Staffing shortages and skill gaps. There's a persistent shortage of experienced medical coders, billers, and RCM specialists, which is especially harmful in high-complexity specialties like pain management. Newcomers often lack the nuanced expertise required for multi-procedure coding, payer rules, and denial prevention tactics.
5. Rising patient financial responsibility. High deductibles and cost-sharing mean patients are responsible for larger bill portions. Practices often struggle with collecting payment up front, communicating financial responsibility clearly, reducing bad debt and unpaid balances. Impact. Cash flow is increasingly tied not just to insurers but to patient payments, requiring new patient engagement and billing strategies.
6. Increased payer scrutiny and utilization monitoring. Payers are using advanced tools, including AI, to analyze utilization patterns across episodes of care, not just individual claims, especially for frequently repeated procedures. This leads to automatic flagging of claims for audit or review, even when documentation otherwise appears compliant. Challenge. Practices must proactively justify frequency and medical necessity for repeat services.
7. Fragmented workflows and technology gaps. Incomplete or poorly integrated systems, EHR plus billing plus documentation, create bottlenecks that increase errors and delay claims. Manual processes persist in many practices, increasing risk of data entry errors, mismatched patient info, and inconsistent workflows. Tech gap. Without robust automation and systems that bridge the clinical billing divide, RCM inefficiencies persist.
8. Broader healthcare policy and economic shifts. Policy changes, for example, cost-sharing adjustments from ACA subsidy expirations, and payer policy updates indirectly increase uninsured/underinsured patients, raising financial risk and collection complexities. Shifts toward value-based care and quality reporting metrics can complicate billing if practices aren't equipped to capture required data.
Thank you for watching. For more information, visit our website www.geoitsolution.com.